What is a contrast agent for arthritis MRI scans? Imagine trying to see the tiny details inside your joints clearly. That's where contrast agents come into play during arthritis MRI scans. These special substances are injected into your body to make soft tissues and inflammation stand out more vividly on the images. When doctors look at the MRI, they want to see the full picture of what's happening inside your joints. Sometimes, standard MRI scans don't show enough detail, especially when it comes to inflammation or soft tissue changes. That's when contrast agents help by highlighting these areas, making them appear brighter on the scan. Most contrast agents used for arthritis are based on gadolinium, a metal that reacts to magnetic fields. When injected, gadolinium alters the magnetic properties of water molecules in your tissues. This change helps differentiate healthy tissue from inflamed or damaged tissue. For example, inflamed synovial membranes, which are common in arthritis, absorb more of the contrast and show up as brighter spots. This makes it easier for doctors to identify early signs of arthritis, like synovitis or inflammation of the joint lining. The process is quick. Usually the contrast is injected into a vein in your arm just before the MRI scan begins. The entire procedure takes about 15 to 30 minutes. The amount of gadolinium used is small, often around 5 to 10 milliliters, and the cost can range from $50 to $100 depending on the facility. In some cases, a half dose is enough to get a clear picture, especially for patients with kidney problems, reducing potential risks. There is also a special type of MRI called dynamic contrast enhanced MRI. This technique tracks the contrast over time to see how blood flows in the joint. It helps doctors understand how active the inflammation is, which can be useful for staging the disease or monitoring how well treatment is working. While contrast agents are very helpful, some newer MRI techniques can sometimes give enough information without needing contrast. For example, sequences like short tau inversion recovery can detect inflammation in many cases. However, contrast-enhanced MRI remains a powerful tool for detailed assessment. Using contrast agents in arthritis MRI scans allows doctors to see inflammation early, evaluate how severe it is, and track changes over time. This helps in making accurate diagnoses, planning treatment, and predicting how the disease might progress. It's a vital part of understanding and managing arthritis effectively.